Hello, and welcome to the webinar on Data to Drive Renter-Centered Planning in Bloomington. My name is Margaret Perez, and I'll be your host today. I work for the City of Bloomington's Public Health Division, and I coordinate a grant through the Statewide Health Improvement Partnership, or SHIP, that seeks to create opportunities for health where people live, work, and play, and we use a systems change framework. This means that rather than focusing on individual behavior change or health coaching to help people make better health decisions, we try and influence the policies, systems, and environments in which health decisions are made so that the healthy choice can be the easy choice. One of these environments that we've grown increasingly interested in is the home environment. That is where people spend at least 60% of their lives. So the conditions surrounding a person's housing have a big impact on their health. Housing is the foundation on which good health is built. Without safe, stable, and affordable housing, individuals will find it hard to manage and maintain their health. Housing is the single greatest expense for most households and may determine whether or not residents have the opportunity to live healthy lives and achieve their full potential. Over the past several years, through the Smoke-Free Multi-Unit Housing Initiative that is part of the SHIP grant that I coordinate, I have had the chance to enter into a variety of rental apartment complexes across the city and meet with property managers and residents. Although our initial entry point was smoke-free housing, we quickly realized that property managers and residents have a whole lot more going on than just whether or not tenants are smoking in their units. We also realized that a lot of different city departments and community organizations are having similar touch points with residents and property managers, and many of us are seeing the same issues. Issues like housing affordability, healthy food access, social isolation, and community safety. Like the school liaison quoted here speaking about her challenges working with students that are unstably housed, while our original touch point might be something positive like education or health or sustainability, it would be tone deaf to assume that our programs or initiatives somehow supersede people's basic needs. The challenges, and really what the impetus of this presentation is today, is that over time we have developed a siloed system in which all of us are trying to do good by residents, but by not working together, we're failing to address the underlying systemic issues that create the inequalities that we are trying to address in our programs and services in the first place. Recognizing this, the city was failing to intentionally include renters in much of its planning and development. So last fall, a group of city departments and community organizations began to meet to talk about how we as institutions can better work together to support people that rent in Bloomington. We call ourselves the Southgate Collective Impact Project, named after the property that hosts our meetings that has been the catalyst for this work. Shout out to Michelle Krause, who I believe is joining us on the call today, for all of her incredible leadership and her support as she's welcomed us onto her property for meetings and has been an active participant in our group. So Southgate is a large multi-unit housing property located in the area of Bloomington where the largest concentration of multi-unit housing in the city. Collective impact is a structured form of collaboration that has 5 main conditions listed here. The group has spent quite a bit of time forming a common agenda, represented here as our vision for what the group hopes to accomplish in 5 years. We've also felt tempted to skip to the 5th condition listed here, which is to begin coordinating and planning for mutually reinforcing activities. However, a critical step, and the reason for this webinar today, is the 2nd condition listed here. We hope today's webinar can help build a common understanding of what data is available on renters and how we might measure our impact if we are successful at more intentionally including renters in our work. It will also help us ensure that each of us in our day-to-day work is making data-informed decisions, which builds accountability and promotes learning from successes and failures in our interaction with renters. With our vision of victory in mind, we have assembled a team of presenters that will help to shed some light on the realities of people that rent in Bloomington. First, Mike Palermo from the City of Bloomington's Planning Division will provide us with a demographic overview and help us to understand the rental landscape in Bloomington. Next, my colleague Kelly DeWeese, also from the Public Health Division, will share data regarding a community health survey that we conducted in 2018 that provides some insights about renter health. She'll also touch on what we're seeing in the data about COVID's impact on renters. Eric Hauge is the Executive Director of Homeline, which is a renter advocacy organization that provides free and low-cost legal, organizing, education, and advocacy services so that tenants throughout Minnesota can solve their own rental housing problems. Their new headquarters also happens to be in Bloomington. Lastly, Pat Longs is a longtime Bloomington renter that also works professionally with people experiencing homelessness. She's going to be popping in and out of our presentation today to provide insights from her 30 years of professional experience in housing case management, as well as her personal experience as a renter in Bloomington to help humanize the data we'll be going over today. Thank you so much to all of our presenters for being a part of this conversation today. So with that, I'm going to have Mike Palermo from our city's planning department kick things off by discussing the renter landscape in Bloomington.
Out of the data and looking at where we're going with the city and what are the trends that we're seeing. My work has increasingly been more into the housing sphere. I work closely with the HRA. Some of you and I see on the panelists I've seen in various meetings. We have the Bloomington Housing Action Team that I've been working with. And as Margaret said, we're really trying to coordinate between our different silos and kind of make sure our work is not overlapping and working together. A lot of this information, I'll try and go quickly and make up some time here. We can kind of go into the details a lot and the minutia. I'm really glad Pat is here today because she can kind of humanize it and really kind of explain, you know, we have the data on one level, but reality can be a little bit different. And the data is great on a high level for guiding those big policy questions, but what's really happening on the ground is important. So to start out, who rents in Bloomington? Bloomington's about a third renter occupied and about a third owner occupied. You can see on this first slide, similar with our multi-family versus single family. What's important to understand though is Bloomington is a completely built out city. So when we're seeing new units being produced, we're being produced in multi-family buildings to better utilize land. So that renter occupied in that multi-family is going to keep growing. Condo buildings are not really being built right now. It's mostly just renter occupied multifamily. So that pie is going to keep growing and keep ensuring this is an important thing for us to look at. Next slide. So who rents in Bloomington? This is looking at race and ethnicity in Bloomington. If you look at owner occupied units, it's about 90% white compared to our renter occupied, which is about 66% white, non-Hispanic. So that's a big difference. You can see and our Hispanic population, and actually it shows a little bit better in the next slide, but you can see that our BIPOC population is more prominent in our renter sphere. So if you go to the next slide, it kind of hits home that our Black population, 83% of our Black non-Latino population is renting. So that's a huge part of that population that's renting, that's not owning. Same with our Latino population, it's 2/3, whereas our white population, it's about 1/4. Go to the next slide. And this is kind of, it's shifting. This is a growing trend. Our BIPOC population, our Black, Indigenous, people of color population, it's growing over the years. In 1970, this wasn't, you know, we were 99% white here, and the metro area was about 3% white. This information is actually in our data book that you can search on our website. If you search, I think, data book, there's a lot of different tables that show where we were in 1970 and where we are in 2010. And it will be interesting to see where we are in 2020 when the next census comes out. But even from the 2010 census, looking at our American Community Survey, where that non-white population is growing. And like we just showed in the last slide, it's growing mostly more in our renter population. And this map here shows where our foreign-born residents live. Not necessarily BIPOC, but you know, a lot of times it is. And you can see that's especially concentrating in our Northeast area. In some areas we're at 30% foreign-born population. So that's important when we're thinking of services. Are there language barriers, or are there other barriers that we need to be addressing because we have a larger foreign-born population in that area. And so that's important when we're talking in our Southgate Collective Impact Group on how do we approach things maybe a little bit differently when we're doing outreach in that area. One other aspect is just household size. Household size in our foreign-born population is higher than non-foreign-born population. In the renter population, I think it's 2.97. Oh no, 2.89 people per household versus 1.95. So that's almost a whole extra person per household for our foreign-born population, which we'll talk a little bit later about overcrowding. So that's significant, especially if we see our BIPOC population growing and if that is foreign-born population growing. Next slide. And so where do renters live? So that we had the foreign-born population, they're also in the predominantly renter area. And to some degree that makes sense if you're new to the country or you're establishing roots, you're starting to rent first. And so that's something that we look at too, renting versus ownership. Well, you can see a large part of our renter population is in that South Loop district. There's not a lot of single family homes. There were a little bit of single family homes that were bought out by the airport for runway noise reasons. But you can see that we have some areas that are a little bit higher, especially in this census tract on our east side. But we have fairly well throughout rental populations. It's a little bit along the bluff, but you just don't have a lot of housing along that area to begin with. So we, as a city, have always kind of required renter or multifamily units along arterial and collector roads. Those are more busier roads to have better access. So it kind of fits along there. And then you can especially see west, we have some predominant senior living facilities too that add to that renter aspect number there. And our development districts, if you're not aware, are Penn American, kind of in the center here. Our South Loop district is this big eastern census tract. Then we have Normandale Lake kind of on the western here, kind of along 494. And that's where we're projecting a lot of our growth to happen in those areas. Next slide. So to give a little historical context, Bloomington kind of grew from the east and moved west. And a lot of our rental housing was built in that kind of northeastern area. Like we said, we saw that concentration of renter housing. And a lot of that was related to the airport. It was the kind of temporary housing. So it's a lot of 1-bedroom units and 2-bedroom units to support airport workers or hospitality industry workers in those rental buildings. And you can see that kind of becomes an issue when we're talking about foreign-born populations that are a larger household size or multi-generation household size, which we'll show on the next slide. But part of it's just the era. We had smaller housing to begin with, but also just who we were targeting. And now that we're 40, 50, 60 years later, that really kind of impacts who's living there and the affordability. Go to the next slide. So we talk about cost burden. So when we say cost burden, it's generally accepted that 30% of your income should, at maximum, should go to your housing costs. And we look at owner versus renter, about 20% of our owner occupied units are cost burden or paying more than 30% of their household income, whereas renters, there's 43%. So there's a big difference. It's almost double. And that's almost half of our renter population that is paying more than 30% of their income. And it's not surprising when you look at our median income for owners is nearly 90,000 and our renters is 50,000. So there is, it makes sense, the numbers. And then these are some tables from Veep that show some information about if you have a housing subsidy or not. And those without a housing subsidy, some of them are paying up to 60% of their income for housing costs. So you can imagine if 60% of your income is going right out the door for your housing costs, that's not a lot of income left over to pay for food or other necessities. Whereas with the housing subsidy can really kind of help bring that down and make it more manageable for those households, and hopefully kind of add some stability to your life. You're not having to make those difficult choices each month on where that money should be spent on what necessities. And this number up here, 67% of households do not receive housing assistance in form of a subsidy. Go on, next slide. And then this kind of dovetails a little bit into our naturally occurring affordable housing. So these are units that don't necessarily have a subsidy, but they're affordable nonetheless. They're at that rent range that is affordable for lower income households based on our area median income for the metro. So they are affordable by just being outright, but that's only part of the equation. They don't necessarily match up with those who need those affordable units. But we were able to, this is kind of newer work we've been doing, mapping out and understanding where our NOAA properties are. So NOAA is naturally occurring affordable housing, and working on strategies and how to keep those units. It's a lot cheaper to kind of keep a unit affordable rather than produce a new unit that's affordable. So you can imagine it's easier to maintain rather than new construction. So that's a strategy on how to ensure affordability. And you can see our NOAA units, NOAA really kind of ties into the age of the building. As buildings were built in the 60s and 70s are now a little bit older, they tend to be more affordable. And not surprising, like we had pointed out in the last slide, it tends to be more east because that's for the era of when they were built. There's a question in the chat real quick that I can answer. Do you know the percentage of renter occupied single family? I don't have that number offhand. I think it's pretty low. It's in the couple hundred single family homes. So if we're talking 11,000 renter units, I think it's like 0.5% or 5.5%. It's pretty low. It certainly has increased over the years, single family homes that have been renter, but it's pretty insignificant when we're looking at the data on a whole. And those tend to shift quickly. Sometimes they're on, sometimes they're off, whereas a multifamily building is typically renter. And at this point, looking at the affordability, this is something that we have been working with our Bloomington Housing Action Team, and which Pat has been sitting in a lot of those discussions. I'll turn it over to Pat to kind of give her perspective on the people that are living in this unit and the work that she's been doing in the NOAA space.
Thanks, Mike. And before that, Pat, I'll be unmuting you in just a moment to give your reactions to this data. We did have another question I thought you could address here rather than at the end. Quick note that Lynn Moore, who's on the call, is in charge of our environmental health division, and she had the data handy. So she noted that there are around 1,500 single and duplex rental units in the city. Okay, so that's responding to that first question. The other question that we had was, Mike, do you know what the rent amount would be for a 1-bedroom or 2-bedroom for a NOAA unit? In terms of what a naturally affordable 1-bedroom would be.
Yes, should have had that pulled up. You know what, why don't you jump to Pat, and then when she comes back, I can have that information. I think it's about 1,300 for a 2-bedroom. But let me look it up.
We'll jump to Pat, and then and you could even address that at the end if you want.
Okay.
And here, let me unmute you, Pat. Here we go.
Oh, okay.
Pat, you're on.
Okay. Thank you, Michael, and thank you, Margaret. That was a good question that she asked, and I hope Michael have the answer. Well, I want to say 12 years ago, I moved into an apartment here in Bloomington. And the reason why I moved here, because I liked it to rent. I love the square footage. And the first 4 years, flight attendants and pilots lived in this building, and the rent never went up for the first 4 years. Well, 2015, the building was sold, and the rent began to soar. Some tenants that reside here in our building were seniors that have been here 15 to 20 years or more. And other residents that moved in, most worked at the hotel, Mall of America, and the airport. The flight attendants and the pilots transitioned out of the building and moved on. The rent for the new tenants went up, and Section 8 wasn't accepted. So they did not accept it, Section 8 no more. Many tenants and seniors that hold the Section 8 voucher lived in fear. Seniors are afraid of being priced out of their homes. Single moms with children was afraid to call for repairs, feared that their children was going to be blamed, and their lease will be terminated or not renewed. Lack of affordability housing is so hard in Bloomington area. Rent is soaring so high, new buildings are being built throughout of Bloomington with just a few voucher holders with a job can only approve to move in. Low income and voucher holders are being redlined. Seniors can be approved under an AMI of 60% of their income. 30% is really needed for the seniors. Residents being displaced and have nowhere to go because of affordability, and will have to leave Bloomington and don't want to leave Bloomington because they really love the area. They work near the house where they live, like the Mall of America, the hotels, and the airport, and will hate to leave the area of Bloomington. I'm turning back over to Mike.
Thanks, Pat. Yeah, and that's the difficult thing, as that's what we've kind of been working on the last couple of years, is trying to prevent that turnover of units and rent going up. One of the things we've done, albeit a small improvement, is the tenant protection ordinance, or 90-day tenant protection ordinance. As a NOAA property is sold, the new owner is required to inform tenants of that sale, and they're not permitted to raise rent or evict without cause or rescreen tenants within 90 days of that sale. So it's a short period, but it's something, the point being to kind of, if that is going to happen, you give ample time for families, for us to kind of mobilize and help impacted households to get into new housing that they can afford. it's a continual problem that we are working on. So I do have those rents for a 2-bedroom and this is all, it gets complicated, but for a family of 4 is typically what they use for affordable. So for a 2-bedroom at 60% area median income, which is kind of the standard Bloomington has settled on, is $1,350 a month. For a 1-bedroom would be $1,124. But as Pat, as you were saying, we really need those 30% area median incomes. So more lower income people, a 2-bedroom, the maximum rent would be $675 a month. So we have very few, if any, 2-bedrooms in the NOAA that would sell for $675 a month. So that's where you see that kind of that need really apparent right there. So it's important to know where things are. You can go on to the next slide. And this one too, and I'll send it back to Pat again in just a moment to talk about multi-generational housing, as we talked about with foreign-born population being a little bit, or being a larger household size, but we also just have larger when we look at, sorry, I'm getting muddled here, but we look at household size between single families and renter households, they end up being pretty much the same. So in my mind, most people think single family homes, oh, that's where the families live, and renters are not where families live. Well, that's not the case. The families living in both. The household sizes are, average household sizes are the same. So there's just as many families living in renter, but typically, like we said, our renter, our units are 2-bedroom units. And maybe I'll jump to Pat a little bit later and kind of keep going for time's sake, and she can talk about this. But just this kind of plays into that overcrowding. As we have more people into a unit, there are only certain occupancy limits that we can have. And then if you have more people than you sign for your lease, Pat can talk a little bit more about the fear of being evicted for that. Go on to the next slide. Another aspect to this, part of our Southgate collective impact included Metro Transit as a partner. They're a key partner in this. You can see here, it's a little bit, maybe it's hard to see on your screens, but that red underlying shade is what Metro Transit calls their Market Area 2. So Market Area 1 is more concentrated in the downtown areas. There's a lot of transit around that area. Market Area 2 has a little bit less transit. But you can see we have the orange line coming in, which is a high frequency bus rapid transit route, which will operate 24/7. We'll have the D line coming in shortly that also will operate 24/7. And we already have the light rail and the red line, as well as some other bus routes in there. That's what the brown lines are. But just having the lines doesn't necessarily mean that they're useful to people. These are great, these colored lines, because they operate typically 24/7. You're not having to worry about missing the last bus if it's going all day long and at a frequent enough time. But Margaret had a great example of where trying to get from Southgate Apartments to Civic Plaza, it would take, I think she said, an hour and a half. It would take 2 buses. It would take like a half hour of walking to get to a bus, then possibly waiting 15 minutes or a half hour for that bus. And you can see on the map, it looks like, great, there's a line that goes right to Civic Plaza, but it doesn't. It's not it's a mismatch. It doesn't quite line up. So frequency is an issue, and when those operate are an issue. And you can go to the next slide. It's even more of an issue when your household doesn't have a vehicle. Then you're reliant on transit or borrowing a neighbor's car. You don't have a vehicle. You're relying on those other sources. So you can see Southgate, the census tract that it's in, it's 15% of households don't have a car. That's a significant amount of people, households with no car at all. So they are transit dependent, and making sure that transit can get them to where they need to go, like essential services at Civic Plaza, is an important aspect of that. And you can imagine if you're trying to, if we're doing Parks and Rec events that are maybe a little bit further away, how are people going to get to that? Or if you're doing after school sports, how do you get to the sports and back home if you don't have a vehicle and transit isn't supporting that? So it's an important issue. And I'll turn it back over to Pat to kind of talk a little bit more about that and talk about the multi-generational housing. And then I think she'll turn it over to Kelly after that.
Thank you, Mike. This is Margaret again, just popping in to say the example that I had, just to clarify, was I did a Google search to arrive for an 11 a.m. appointment on a Tuesday, just in normal times, via bus from Southgate Apartments to Civic Plaza. The shortest possible trip I could find, again, this is a one-way trip, was 45 minutes. It was only one bus, but it included 30 minutes of walking. So again, that's one way, 30 minutes of walking, 45 minutes. So you're on the bus for 15 minutes total. So now imagine that it's January. Imagine that you have a stroller or a couple of kids. A lot of the reason why is people are coming to public health is because of WIC appointments. So they have to bring their kids with. And so that just kind of helps to illustrate that even though there's those lines available, if somebody is dependent on public transit, it's really not a convenient way of getting, for example, to Civic Plaza or across the city to the west to access some of our beautiful park systems, because it's just not convenient. And with that, I will unmute Pat and she can give some reactions as well.
Thank you, Margaret, and thank you, Michael. I want to talk about the bus transportation. And if you don't have no car, it's so hard for the, for the low income residents and especially the moms with children. The bus transportation in Bloomington, they run at a certain time. And we have some residents that have shifts and work 2 jobs and get off a certain time. They start work a certain time. I had a young lady that goes to church with me because I go to church right down the street from where I work at. And she often said that she's trying to keep her job, but her problem is that the bus don't run they don't run early in the morning for her to get to work on time at 7. So I volunteered to get up in the morning, take her to the Mall of America so she could get the train so she could get to work, or she would have to walk. And so I had did that to help her until she was able to get a job closer to her home. And then I look at a lot of other people that had to walk, they had to use their bike because they either got off of work late after 11. And so if the buses is not running, they drive their bikes home or they carpool or they would find some way to get home. Some people even walk. And because most of them have to work 2 jobs, they either carpool because of the hours that they get off at night. I have seen many of them walking and to keep their rent paid, to keep their basic need met, they will have to do these things. Then I would like to talk about some some families that are renting 3 bedrooms in Bloomington. They tend to allow their friends and family members to move in with them because of lack of affordability, to help each other out. They fear to communicate with their landlord because they're already in lease violation and they're afraid of eviction. And so they sneak their friends and family in just to help each other out until their friend or family can find some housing. I promise you, these people don't want to do it because they don't want to get evicted. Many lack their rights and responsibility as a tenant because they don't know what to do or they don't know how to communicate with their landlord. Many low-income residents don't want to leave Bloomington because of their job near their home, and living in the city, they kind of afraid to go, to Minneapolis or St. Paul. They would do whatever they can to stay in Bloomington because they feel safe here, and the school for their children is a great support. I list some resources and what the low-income residents should have, like Senior Link, life skills, tenant training, self-sufficient program, and that goes with the Section 8 holders, new gates for single moms, energy assistance program that can help them with their utilities, especially the ones that's renting a house. Because one of the biggest things is renting a house. The rent is it have to be paid every month. Then you got the water, sewer, trash, and light and gas. Those are extra bills that need to be paid. Energy assistance will help with water bill, and it will help with your lights and your gas. And if people have the resources, then they can use those resources. They got BEEP, they got Hennepin County, they have the GAP program, and many of them need trauma care and medical support. Many residents don't know about these resources, and they can get many assistance to help them maintain their housing. I'm gonna turn it back over to Kelly. Is it Kelly? I'm turning it over to.
Yes, thank you, Pat.
Yep. Hi. So Mike and Pat had talked about, who rents in Bloomington and some challenges that they have. And I'm going to talk about the health of renters compared to owners. In 2018, Bloomington Public Health conducted a community health survey of residents in Bloomington, Richfield, and Edina. I'll be presenting some of the results from that survey specific to Bloomington residents. Before I tell you about any data, I want to briefly mention how the survey was done and how we should interpret it. For some surveys, such as the Hennepin County SHAPE survey, residents are randomly selected to participate based on their mailing addresses, and you can therefore say that the results are representative of the entire population. Our survey did not have random selection. People were asked to participate through Facebook ads, and in-person outreach was done at community events to reach race and ethnic groups that were not well represented in our data. So because this wasn't a random sample, we can't generalize the results to the entire city of Bloomington. We can only say that of the people who took the survey, this percent said that they did XYZ. Today, I'm going to focus on the differences between people who reported renting their home and those who reported owning. There were 372 Bloomington renters and 836 Bloomington owners who took the survey. So this data is based on those people only. When we look at the data we collected by housing ownership, we see some pretty large disparities between the groups. We already talked about some demographic differences we see in renters compared to owners, but we also see differences in physical health, mental health, health behaviors, and healthcare access. Next slide. So this, in general, Bloomington renters who took the survey reported overall worse health compared to homeowners. Renters had in general had worse health, higher rates of chronic illness like diabetes, asthma, and obesity. This graph shows some of the health-related questions in which there were differences between renters and owners, but there were more differences than just those shown on this graph. On this graph, renters are represented by the blue bars and owners are represented by the red bars. So the bars show what percent of each group chose these survey answers. So as you can see in this graph, over 3 times as many renters reported that they had fair or poor health compared to homeowners. More renters than owners reported that they had diabetes. More renters than owners reported that they didn't get any exercise last week, that they smoke cigarettes, and report worse mental health. So they have more poor mental health days per month. They feel isolated more often. And some other questions also indicated that they have more mental health diagnoses and higher stress levels. Next slide. So renters had worse health compared to owners, but they also reported less access to healthcare and use of healthcare. This graph here shows the percent of each group that said that they skipped or put off a certain type of healthcare in the last 12 months because it was too expensive. So on the far left, it shows that 40% of renters had skipped any type of healthcare that they needed because it was too expensive in the last 12 months. So that includes the dentist, primary care doctor, mental health care, buying medicines or devices, and medical treatments. So you can see that the differences, are twice as many renters than owners reported that they had to skip healthcare. And those, the rest of the graph breaks it down by the specific type of healthcare that they skipped. So almost 30% of the renters in the survey had skipped going to the dentist because of cost in the last 12 months. About 15% said that they couldn't get any of the medications or treatments that they needed because of the cost. And then there's also differences with mental health and assistive devices. Self-report of how easy it is to get health care also is worse for renters compared to owners in this survey, and insurance rates were very different. 9% of the renters in this survey did not have any health insurance compared to only 1% of the owners. So 9 times as many renters were not insured compared to homeowners. Next slide. We see differences in some other areas as well, like socioeconomic factors and access to services and resources are different between renters and owners in Bloomington in this survey. This graph shows the percent of renters and owners that said that each resource was very limited or hard to get to in their community. So you can see in this first section, or the first bar, almost 30% of renters said that job opportunities were very limited in their community. And many more renters than owners thought that. More renters also thought that affordable housing was more limited, that recreation spaces were harder to get to, that reliable transportation was harder to get, that there were fewer safe and attractive places to walk, and there were fewer places to buy fresh vegetables. Another major difference between renters and owners was in food insecurity. 20% of homeowners said that they sometimes or often worried that their food would run out before they have money to buy more. That number was more than double for renters. So 42% of the renters in this survey said that they were food insecure and either sometimes or often worried that they'd run out of food before they had money to get more. One other difference we can see in the survey is in what people think about their community and what their community needs. One of the questions in the survey asked, what are some of the top things that would help improve your community's health? More renters than owners thought that the top things that would help community health was more access to healthier food, easier access to healthcare, and more affordable housing. That was in contrast to homeowners who were more likely to say that things like walking paths and social gathering spaces were their priorities for improving community health. Next slide. In those last slides, I talked about the health differences in renters compared to owners. We also saw some large differences between people who live in this Southgate zip code 55425, regardless of whether they rent or own, and the rest of the city. So this graph is showing the difference between that zip code and the other Bloomington zip codes. So survey respondents in the 55425 zip code reported higher rates of diabetes, food insecurity, and not having health insurance, and more respondents reported that affordable housing was very limited. So all the information I just told you about was based on our survey data. We can also, see this in real life. So I want to go over to Pat to share some observations that she's had of actual people.
All right, Pat, you're on.
Okay, thank you, Kelly. Okay, many residents don't get proper care from a primary physician. They have to choose to get proper care. So if you have your own doctor, you can have proper care. But yet most of them run to urgent care a lot, especially seniors that isolate themselves. Their health deteriorate, and they only go on when they have to. Many don't have nurses to come to their home because they social isolate. Food and basic needs sometimes don't be met. Most live on a fixed income and have a big spend down that will eat up their income, and that's with the seniors. Families struggle to take their children. I should have talked about this when it came to transportation, but a lot of them struggle to take their children to WIC appointments and primary care because of the bus transit schedule. Just like Margaret said, it takes so long for them to even give them to a WIC appointment. But now a lot of them don't know that they can use the medical rides to get their children to the doctor. They lack resources. They often forget their needs because of their jobs. They often forget their health needs because of their job, that they are working to sustain their housing and go to work sick because they don't have the benefits to get off. Bloomington resident that I knew that was a senior, and she lived in the unit that I lived in for over 20 years. She actually worried herself to death because of fear of being priced out of her home because she was a Section 8 voucher holder. Many residents that are staying in most of the apartments, the bigger units that's in Bloomington, are living in poor condition, repairs are not being done, and when they when they order the repairs to the maintenance, they are being ignored, and it would take a long time just to get a light fixture fixed. And then many of them are depressed and they get sick because of the condition that they are living in. Most of them self-medicate themselves. Many complain about the request of the repairs being done, and the problem never get fixed. Affordability in Bloomington is a disparity for the resident to move to another apartment in the Bloomington area, and it keeps them trapped in their unhealthy apartment that they are living in. And these are the bigger complexes that are in the Bloomington area that is not taking proper care of the residents or the property that the residents are living in. And if we can make a big impact in our community with empathy and compassion, and with empathy and compassion, we can create inclusion. And with inclusion, we all can prevent homelessness. I give it back to Mark. Is it Eric? I give it to Eric.
Thanks, Pat. So yeah, Margaret, you want to jump to the next slide? So yeah, thanks for sharing that, Pat. It's important to get a sense of the real world impact and that you've seen right on the front lines. And so I'll just do a brief introduction about our organization and the perspective that we can share. So Homeline is a statewide organization. We've started as a program in just suburban Hennepin in the early 90s, and so we've served Bloomington since we started, but since then also have expanded to the rest of the metro and the rest of the state. And we've advised over a 250,000 renter households since we opened in 1992. Our main program is a free and confidential legal hotline that any renter in the state can call or email and get free and confidential legal advice. And since expanding to the entire state, that was kind of as far as we wanted to go geographically, because we know the laws in Minnesota, but not necessarily other states. So the other expansion that we're working on is continually trying to add dedicated language specific staff to our tenant hotline. So we advise renters now in English, Spanish, Somali, and Hmong languages. And our staff is made up of experienced housing attorneys, advocates, tenant organizers, public policy director, and we rely a lot on law student volunteers and community volunteers and interns. And we actually just recently moved our office to Bloomington. I'm in our office right now, I'm the only one. But we're here in Bloomington, so once we reopen to the public, would be happy to have folks come visit and volunteer if you want to. Our programs do range beyond just our tenant hotline. We also do education. We put on trainings for tenants and landlords, social service providers. We really want to make sure that both tenants and landlords know what the rules are, so that housing is in the best shape and for everybody. And then we also do some research and policy advocacy. So if you want to jump to the next slide. This is just a quick overview. So I'm going to just give you some basic information about our clients throughout the state, and then break it down just specifically in Bloomington, just to kind of compare and contrast. In last year, calendar year 2019, we advised just over 15,000 households. So if you estimate that there's maybe 630,000 renter households throughout the state, we advise around 2.5% to 3% of the households every year. And I think one important caveat on that is that, despite our hotline being free and confidential, it's an attorney-client privilege, and there's really pretty minimal barriers to accessing us. You just give us a call and we're going to either answer the phone or get back to you within an hour or two, and it doesn't cost anything. There still are hundreds, if not thousands, of households out there that face a lot of the same issues that I'm going to talk about in the next slide, that just don't know or don't recognize that the conditions that they might be living with or the practices that they're seeing experiencing in their rental housing is something to be, to dispute, and that they might be in substandard housing and not know that there's tools and things that they can access. So yeah, statewide, the vast majority, we do have no intake. We have a very minimal intake process, so we only ask a few questions to basically get this data that's on your screen right now. And we have no income guidelines or issue guidelines. If you're a renter and you're in the state, we'll advise you. Even without having those any sort of income guidelines, the vast majority of folks that call us are within low income or very or extremely low income categories as defined by HUD. The breakdown of clients is usually around 70% female, and then you can see at the bottom there statewide breakdown of the caller clients who contacted us, their race. Okay, can you jump to the next slide? And then this is just a list again of statewide, the reason why people called us. We try to categorize the issue that people are calling us about into a list of approximately 30 or so different issue types. And this is pretty consistent from city to city and even year to year and throughout the state, this sort of general breakdown that repairs are sort of above and beyond what we hear from a lot of other folks. And repairs is a very large category. I mean, it can mean anything. Probably a quarter of our repair calls are something to do with water, mold, or water coming into a unit. We do separately break out infestations and bed bugs because that has been a big issue. And so those are kind of, that is also, legally speaking, it's a repair issue, but that's kind of broken out. And then you'll see evictions is up there as number 2. Security deposits, that's a big issue with housing access. If you're not able to get your security deposit back, which the vast majority of those calls, those clients that are contacting us, it means they've moved out or they're about to move out and they fear or have gotten notification that they're not going to get their deposit back, which can have a very large impact on their ability to stay stably housed in their future housing. And then notice to vacate is basically, in most cases, it's a landlord-initiated notice to vacate to ask the tenant to leave, which is different than number 2, eviction. When somebody's calling us about an eviction, we only market eviction if it really is a court action that has been filed that is directly having an impact on them then. They may be on their way to the courthouse and calling us, or they may have already lost or something in court and a sheriff is coming to remove them and they want advice about that situation. So that's what evictions are. All right, well, we can jump to the next slide and talk about specific to Bloomington. This is a slightly different timeline. I looked up the most recent year period. So this is July of last year through June, end of June of this year, which does, and we'll talk about it in a later slide, it does definitely have a significant impact. The last, obviously, 3 to 4 months, the types of issues that people are calling us about are significantly different due to the pandemic. So that has had somewhat of an impact, but that's the numbers on, so over 300 households that we served in Bloomington, pretty similar income level. I think there were more folks within the very and extremely low income guidelines that were contacting us from Bloomington. As compared to statewide, which is not too surprising, but there's a larger percentage of renter clients that are identifying as people of color or indigenous that contacted us within Bloomington. And then I think, this is slightly incorrect. I think the top calls from different cities are, let's see here, Minneapolis, St. Paul, Brooklyn Park was just ahead of Bloomington and not Richfield. So Minneapolis and St. Paul is where we get most of our calls, but Brooklyn Park was 3rd and Bloomington was 4th in this time period. And then, so then the top issues, it mirrors what we saw statewide fairly closely, but I will say there were an increase. Comparatively, there were more clients contacting us about some sort of housing instability type question. So that would be a pending eviction, notices to vacate. That notices to vacate, where we had more calls about that than security deposits, which is somewhat surprising. And then there was also a pretty good number of lease non-renewal type calls and rent increase calls. So all types of calls and legal issues that people were contacting us about that really have to do with involuntary displacement. These are situations where the tenant is being evicted, or they're being told you have to leave, and it's not them asking to leave. And so I mean, I think this sort of points to, you know, and I mentioned it before that you know, in the last year, over 330 households in Bloomington contacted us. That really, I think, is only somewhat of a sliver of the number of people that are impacted by these types of issues. You know, when something like, as folks might be aware of, the Normandale Lake Estates, and Pat has shared a little bit about some like apartment sales and displacements that people have been impacted by, or landlords choosing to change their practices in terms of the rent amounts and their willingness to take Section 8. All of those types of potential threats of displacement, really there's a significant amount of trauma that's involved with those types of threats of displacement. And we refer to them as fragile leases, that, you know, a lot of lease terms in the first year are like a 1-year lease term, and then they revert to a month-to-month basis after that. There are some landlords who just, as a business practice, just do month-to-month, which is sometimes seen as, well, it's giving both the tenant and the landlord the flexibility. And, you know, sometimes there's a bit of a stereotype, not sometimes, there is a stereotype of renters as being transient. But, you know, from our perspective, what we see a lot is that a lot of times this is not voluntary moving. It's you know, our inquiries on our hotline, particularly from folks in Bloomington, are more frequently about these types of involuntary displacement, and that kind of constant threat that, and that we're even more in the midst of it right now with the pandemic and the way that the governor's eviction suspension works. It's 30 days at a time that gets extended, and so we're always less than 30 days away from potential mass filings of evictions. That's really, I mean, that's a significant issue because of the pandemic, but that really is, a lot of our clients are sort of facing that every month before this, because they were on month-to-month leases, and they could get non-renewed for no reason whatsoever, or see a rent increase. And then I think this slide that Margaret had shared, I think is a useful sort of, you know, unfortunate cycle that we have seen our clients face, that, you know, they have difficulty finding affordable, accessible housing. They may then not be willing to report conditions that are not in good shape, because they might get a negative response from the landlord, even though retaliation, there are statutes, state statutes, there's city ordinances that protect tenants against retaliation. There's also, there's now a common law that one of our lawyers at Homeline helped argue and defend at the Minnesota Supreme Court. But the reality, the practical application of a lot of this is that there's folks that don't know that they have those rights, and there's just so many ways for retaliation to come about, that can impact somebody's housing stability and their health if they're constantly looking around their shoulder, concerned that their lease could be non-renewed. So is Kelly taking the next slide up, or am I starting on this one? I can't remember. Kelly, maybe?
Yep, I think we're going to have Kelly kick off talking about the health data, and then Eric, you can pop back in with your observations.
Yeah, so I wanted to talk about the impact of the current pandemic. So with the current pandemic, we've seen impact on renters as well. So this data on this graph is data from May 11th to June 28th collected during phone calls with people who've tested positive for COVID. So 73% of the COVID-19 cases in Bloomington live in private residences. So private residence is a apartment house, anything that isn't long-term care or group home, homeless shelter, that sort of thing. So this graph is showing that of the people who live in, of the cases who live in private residences, what percent of them live in multi-unit housing, and about 1/3 of them live in multi-unit housing. In multi-unit housing, there's a higher chance of contact with neighbors who are infected. You know, there's more common spaces like hallways, elevators, and lobbies, which is the potential for spreading infection. Additionally, just as some anecdotal evidence from having done interviews with people who've tested positive for COVID, with people who live in apartment buildings, we're seeing a lot more spread within a family. So we'll have one person come through and talk to them one week, and they'll say, well, they can't really isolate from their family because they're in a 2-bedroom apartment and there's 5 people, and it's just not an option to go somewhere else. And then maybe in the next week or two, we'll see the rest of the family members come through because they got infected because they weren't able to isolate. That doesn't seem to be happening as much with people who live in houses. And so that's not specific to renters, but we do know that, you know, more renters are renting in multi-unit housing compared to single family homes. We've all heard about the health disparities with COVID-19 in terms of racial equity as well. In Hennepin County, Black residents make up 13% of the population, but account for 40% of the confirmed COVID cases. And new census data has revealed that about 1/4 of Black and Latinx renters missed or deferred rent this May, compared to only 14% of white renters. So this pandemic is disproportionately affecting both renters and people of color. See if Eric has some things to say as well about the pandemic.
Yeah, thanks, Kelly. So yeah, just, I mean, broadly, we have fielded over, I think, close to 2,400 calls now from renter households throughout the state since about mid-March on issues that are specifically related to the pandemic. So that's really, for the most part, you know, what does the suspension of evictions and lease terminations mean, and how long is it for, and how am I protected by it? And if I'm impacted by a threat, what can I do? And any sort of threat of displacement. We are getting more calls about inability to pay rent, and then, you know, a number of other things that are not quite as, you know, front and center as the pending threat of many evictions, but on a day-to-day basis definitely impacts people, is privacy concerns. You know, I'm immunocompromised, and I don't want the landlord or their agent coming in to do showings or et cetera. Also, loss of amenities, and then just sort of generalized health concerns about living in a multifamily building that might be impacted. Our clients in Bloomington that have called us about pandemic-related issues are comparatively disproportionately lower income, and specifically from Bloomington and Richfield and Minneapolis, we've received a significantly larger numbers of inquiries from Spanish-speaking clients and Latinx renters asking about financial assistance because they may not have been able to access other pots of funding. And to be honest, I mean, we've generally seen an increase in financial assistance related calls, but you know, inability to pay rent isn't really a legal issue. It comes up in our calls related to eviction, but pretty much it's a survival issue. It's not a legal issue. So there's not much we can do other than explain what the deal is with the eviction suspension, and encourage people to reach out to Veep and the county and other pots of funding, which hopefully there are more coming now that the state has set aside some money. And so, yeah, I think that's all I had to add on that slide. Pat, sorry, Pat, I think you were, if you wanted to provide any perspective based on this or any of the items that I was talking about in terms of Homeline's clients.
Oh, okay. Thank you, Mike. Many residents that's in Bloomington are impacted by the COVID-19. Most of them worked at the hotel They worked at the airport and the Mall of America, and have been affected by the COVID-19 because most of them had got laid off. Now, the biggest elephant that's going to come in the room at the end of the month is when the $600 extra funds for unemployment stop. And this ends at the end of the month, and most of these people rent is going to get behind. And I really pray and hope that they did save up enough money. But one of my biggest fear is most of them going to get behind on their rent because they was getting extra funds. A lot of people are not being called back from the mall, the restaurants, from the hotels, and they're all waiting for their jobs to either call back or they're looking for another job. And most of them are still unemployed. We still in the pandemic, and every resident that have a school-age children and went from a transition from being a mom, now being a substitute teacher, then most of these kids have a disability. They need their home. They don't need to be transitioned out. They don't need to go into another dilemma by being evicted. You know, this could traumatize the family, and it could traumatize the parents as well. Many residents will be impacted by this, and the resources and prevention will take place for those who qualify. And they do have the GAP program, and many can't qualify because they don't qualify because of their source of income, and they don't have no other alternative and people to turn to. And that concerns me because some people qualify for the GAP program, some people qualify to get some assistance, but some people don't. And I worry about the people that don't. They're still waiting for employment to call back. And so with the COVID-19, it's not only affect the family and keep the families in their home, but it affected their jobs. And with the special funds that they was getting is going to end at the end of July. And that's one of the biggest fear that a lot of resident is coming up against, paying their rent going forward. Turn it back over to Mike, or let me see what's her name.
I'm on.
Okay.
Thank you, Pat.
Okay, Margaret.
So this is Margaret. I'm gonna be closing out this presentation a bit. We're winding down, and then we're gonna have some Q&A. So just a reminder that you can start putting questions that you have, questions or comments that you have into the chat box. You can chat them directly to me or to all participants, kind of up to you. I'll try to be monitoring them, and we'll be responding to those in the last part of the presentation. So here on this screen, we've got this pyramid, kind of like an impact pyramid, and I use this a lot, just thinking about the work that I do on the grant that I coordinate for the SHIP grant. And I think traditionally in public health, we've spent a lot of time at the top of that pyramid, in counseling and education, telling folks, you know, what they need to do to get and stay healthy, directing them to resources, that sort of thing. And certainly those are important things, especially when we've got kind of an unknown threat like, you know, COVID, where we really need education on this because we don't know much about this disease. But as we think about really impacting people's lives and people's health, you know, where I try and live in my work is towards the bottom rung of this pyramid. So trying to change the context and addressing socioeconomic factors, or, you know, what we call the social determinants of health. So essentially, what are all of the underlying factors that influence your health outside of the specific ailment you're experiencing that brought you into the doctor's office? So understanding the social determinants of health helps to explain why people of color, who we know are disproportionately renters, are experiencing higher rates of COVID. A purely medical approach would treat all individual cases the same. So we tell them to, you know, wear a mask, social isolate, you know, take plenty of liquids and eat chicken noodle soup. But when we factor in the social determinants of health, we realize the very real systemic barriers that were already disproportionately impacting Black, Indigenous, and people of color, who again, we disproportionately know are renters. And those systemic barriers were in the way before the pandemic even started, and they're now being compounded. So it's essential to understand that an individual's ability to comply with public health guidelines to stop the spread of COVID has almost everything to do with the bottom 2 rungs of this pyramid, all things that we have discussed on this webinar today, and very little to do with their grasp of the gravity of the public health threat. So what are the implications for the public sector? I'm going to shift gears a bit. I want us to think about everyone's favorite season in Minnesota, road construction season. Let's imagine our public works department is doing some mill and overlay on a local side street in front of a large multi-unit housing complex. Several months ago, the city's engineering department held an open house in the neighborhood to get ideas for pedestrian improvements. Invites were posted to the city's social media channels, and an invite was mailed to property taxpayers. Not surprisingly, only homeowners came to the open house, and most were white and older. And again, I'm calling out this example as just an example, a hypothetical situation. And I will say that I have done this. I have been in this boat, and this is not, uncommon for us. So this isn't to call out any one department by any means. So then several weeks before the project begins, notice is sent to residents with project details, informing them of parking restrictions that will be in place during the project. On the day of construction, several cars are still on the street, so the city tickets and tows and gets on with the project. Residents come out of their units from the multi-unit housing complex a few hours later and realize their cars have been towed. But now they must choose between paying rent or getting their car out of the impound lot so that they can get to work. They obviously choose the latter. But residents are now upset, and rightfully so. They go to the property manager demanding to know why they weren't informed of the project. Turns out, like the open house, tenants were left out of the notice process. So this example just highlights, again, a hypothetical example, but it highlights just the lack of relationship that the city has with renters. And the implications for that is that renters weren't included in the initial street design. And it also means that, we as a city never hear about the inconvenience that they experienced of getting towed. Often residents' main point of contact and where a lot of complaints get lodged and stay are with the property manager. And there isn't as much of a direct line between residents and the city. And what that really means, though, is that the city, we as city staff, don't get a chance to learn or improve. And the same scenario plays out over and over again. But while we're busy not hearing from renters, we do hear a lot from other residents. We've all heard the phrase, the squeaky wheel gets the grease. And I'm sure that that rings true for many of us on today's call. But we have to ask ourselves, who feels comfortable complaining or reporting issues to the city? Who has access to the information in the first place? How do those complaints influence the way that we do our jobs? Who is often complained about? And who aren't we hearing from? We have a strong, perhaps unconscious perception that when renters don't show up for our town halls or community events, that they're disengaged or apathetic to issues impacting the city. But what if instead it was a lack of inclusion, a lack of empowerment, a lack of agency that led to their lack of participation? Lastly, as city staff people, we are often tasked with following written policy and procedure, but this can get in the way of achieving institutional equity. As we've seen today, just because programs or policies are in place to help people, it doesn't mean that they are working optimally or to the benefit of renters. When we as staff people notice a policy or program isn't working as intended or is having unintended consequences, how are we working within the city to address these issues and avoid harm? And that is one of the aims of the Southgate Collective Impact Project, is that we're trying to recognize where we have blind spots when it comes to our interactions with renters and trying to intentionally include renters in our planning processes to help kind of rid us of some of those blind spots. Lastly, I'm going to have Eric just touch on a few policy recommendations that he has, or steps that cities can and residents can take to support renters. And then we're going to go into Q&A.
Thanks, Margaret. So this is not intended as a critique of Bloomington in particular, any particular city really. It's more of just we get asked a lot by cities, by state legislators, by advocates, by renters and landlords about what could be improved in terms of rental licensing, inspections, and then other related, sort of on a local basis. That's been kind of the biggest touch point that cities have with renters, is through the licensing and inspection of rental units, and to ensure that they're safe and not in disrepair. And so, but that's not. But as I think Margaret just really outlined really well, is that there's multiple actual touch points that a city has with renters. And so that's sort of this first bullet point, is just who, what, when, why, where, and how is the city interacting with renters, and also maybe where should it be more, and where potentially where should it be less, if there's potential negative impacts happening. So, we have advised folks in a number of cities throughout the metro and even the state, as recently as this year and over the past 5-10 years, about a variety of policies that cities can enact. Particularly, some inspections departments we've seen. Again, this is not a critique necessarily of Bloomington. I don't have the sort of direct on the ground knowledge, not being working on our hotline on a day-to-day basis, but other inspections departments we have seen, retool and reevaluate how they look at their work, being in the past very much focused on their interactions with landlords, because that's who they potentially see more often, and they have to get into the unit and talk to the landlord about doing an inspection. But ultimately, the real customer there, is the resident that's impacted by the quality and condition of the rental unit. And then just recognizing the potential sometimes negative impacts that instigating some sort of violation of inspections or some other housing quality aspect can sometimes have on renters' housing stability. And so that's why we're 100% on board with making sure that cities and inspectors are the people on the ground that can be most knowledgeable about making sure their units are in good condition. But sometimes that can have negative impacts on housing stability. And so coupling that sort of enforcement and regulation with additional renter-focused protections to prevent that sort of involuntary displacement that we talked about before. And so, examples that other cities have done is as far as how improving access to housing to actually folks get into affordable and quality housing, is regulating screening practices that can be sometimes aggressive and screen people who are good tenants out. Regulating security deposits, as I mentioned, that's one of the top issues people call us about, and it's a significant. It can be a significant barrier to accessing housing. There's an effort at the Minnesota Supreme Court right now, a case regarding Section 8 discrimination, and a policy around making that a fair housing issue, and that you can't deny people on the basis of having a Section 8 voucher and using their voucher to pay rent. And then there's all sorts of potential local opportunities to really impact that area of involuntary displacement, whether it's supporting organizations like ours and Legal Aid and others that help to advise and defend tenants facing formal eviction actions or actual policies to prohibit the sort of no-cause evictions, no-cause lease terminations that we see all too often. Let's see here. And then another thing that I mentioned earlier that I guess I should add to, and maybe this might be something that Bloomington's worked on already, is I mentioned that probably close to a quarter of the calls that we get about repairs are related to mold or water in the unit, which can definitely have a direct health impact. And so that's one thing that we've really encouraged cities to do more is, and again, I'm not sure where Bloomington is on this, but we've seen in other cities really a reluctance of inspectors to really delve into issues of mold because it can be complicated and complex. But there's plenty of experts in that field and ways to investigate and identify problematic mold. So those are just a couple examples. Specifically, there might be more that that cities can do right now in response to the pandemic. There has been discussions from a number of cities about if there is a lifting of the state suspension on evictions, which there actually, there effectively is. The governor a week ago today issued an order that will slightly dial back some of the protections of the current state eviction suspension. It still is going to protect people from non-payment evictions, but there is a potential large-scale eviction threat pending if and when the state moratorium lifts or is dialed back. And there's plenty of things that local units of government, I think Bloomington has done already, putting money towards rental assistance, but also contemplating what sort of local protections could be in place to divert cases away from formal eviction or informal eviction, and to try to get parties talking to one another. So I'll leave it at that, I guess. There's plenty more ideas, and I'm happy to chat one-on-one with anybody.
Thank you, Eric. And with that, we are now at the point where your questions are welcome. I'm gonna kick us off by just answering a couple that have popped up in the chat box. Both comments and questions are welcome. Because of the way I set this up, I'm not 100% sure what it looks like on your end in terms of your ability to unmute yourself or speak directly. So if somebody wants to chat me, somebody that's an attendee, how that looks on your end, if you're able to unmute yourself, if you do want to speak, just let me know. And I can unmute you on my end. Otherwise, you're welcome to leave a comment or question in the chat box and I'll read it off for you. I did get a comment from Akua Sare, who is on the phone. I hope I'm pronouncing your name all right. I believe Akua must work for the Met Council or Metro Transit. And the comment was, sorry, here we go. Just want to comment that transit schedules and routes depend on density. Sometimes city infrastructure isn't conducive to transit either. No sidewalks, space for bus to pull over, as well as other market factors. Mode of transportation is factored in as well. Bloomington tends to have more drivers than transit riders. And so I don't know if Mike, if you wanted to respond to that, I have a response that I could, note as well.
Well, yeah, and he's absolutely correct. It is reliant on density, and our comment really wasn't to say Metro Transit's not doing a great job. They're a partner in all of this, and we work very closely throughout a variety of projects with Metro Transit. The comment was really the point was really to acknowledge that there is a need in the community and that we need to be creative about how we address that. Looking at this through the framework of our Southgate collective impact, that became an issue early on, that there are people that are no vehicle or one vehicle household, and it's hard to participate civically when you're stretched transportation wise. So, that could translate with Pat's example about the WIC clinic. Maybe it's a mobile clinic, maybe it's a branch office that we do, maybe it's better promotion of the health ride ability or service. There's any number of things. It's just more about acknowledging that there's an issue that we need to address. And I can say from a planning perspective, we are working on how to create that density that would encourage more transit. And we work closely with Metro Transit on that. Our 98th Street station is a great example with that orange line, where it's not very dense area, it's a high traffic area, but we are looking to concentrate and do transit oriented development around there. And as part of that, Metro Transit also realized that they need to have feeder routes into that. So they're studying ways to better complement that service. So it's a partnership, it's an iterative process, and it absolutely requires a built environment that is conducive to transit.
So I am seeing that people are unable to mute themselves. So if you want to speak, just comment in the chat box and I'll unmute you. Just say something like, I want to speak, or unmute me, or something like that. Otherwise, I do have a question from, well, one thing to note, Matt Jerkins from the library asked if a recording of this will be made available. Yes, I have been recording. I actually forgot to press the record button at the way beginning. But I have the recording since Mike started talking at the beginning, and that will be posted. I will send out that link to anybody who registered for the webinar that's been attending, and then I'll also be posting it somewhere publicly on our website. I'm not sure exactly where, but I will make sure to share that link with everyone that's been on the webinar so that you can share it with others. And I'll also make the PowerPoint available. A question from Vivian: do we have demographic info on income versus COVID-19? I'm sure those living in poverty are also impacted disproportionately. And Kelly, are you able to speak to that question, either anecdotally or direct us to where we might see more data on that?
Yeah, so from what we've been doing at Bloomington, we don't have any income data. I am sure, but not aware of any specific places that would have more information on that, but I'm sure that those exist. Anecdotally, I can say that most of the people I've talked to who are above the age of like 25 or below the age of 70 a lot of them have been low income, particularly people who've been very concerned about their job and saying that they'll get fired if they can't go to work. They don't, and you tell them, well, that's illegal, they can't do that. Well, they say, well, what am I going to do about it? So people who are a little lower income and don't have the bargaining power to in their jobs because they are lower paying jobs.
Thanks, Kelly. Akua, sorry, and again, sorry if I'm mispronouncing your name. Akua, I did unmute you and you're able to speak.
Oh,
oh, here we go. Oh.
I do work for the Metropolitan Council / Metro Transit. I don't have anything to say. I just wanted to share that there's like a full process, just in case anybody thinks that we're not like considering multiple factors when we do our route planning or scheduling. We're not intentionally not trying to have early routes or not having late routes or more frequent routes. That's all I wanted to say.
Thanks, Akua. Do we have other comments? I am seeing.
I just want to jump in and kind of going back to Kelly on the COVID. I don't have income information, but unemployment from last year to this year, from May 2019 to May 2020, has increased 9.7%. So Bloomington is now 12.5% unemployment rate. So obviously that's going to impact income. And if I'm remembering correctly, it was like 50% of hospitality and retail jobs have been lost. Now they might have recovered. The data I think was from April, so it's changing rapidly. But those business and service jobs, I think it was like 7% decrease. There was a huge impact on what jobs were lost, and they tend to be those lower income jobs.
And if I can add really quick, this is Eric. This is not representative of, it's just representative of the people who called us from Bloomington in the past related to COVID related issues, and close to over 60% of our clients in Bloomington that called about COVID related things identified as extremely low income households under HUD guidelines, which is up if you compare it to the previous year.
Thank you. I am not seeing any more questions. Speak now or forever hold your peace. Otherwise, you can reach out to any of us listed here as our contact information. Specifically, if you're not currently involved in the Southgate Collective Impact Group and you'd like to be, or at least receive updates or notices about when we're meeting and what we're talking about, feel free to email me and I'll get you on the list. And I also just want to note, for the many people on the call today have been involved in the Southgate Collective Group. This kind of replaced our virtual meeting that would have been scheduled for this month. And I am, kind of weighing how we proceed in the midst of COVID. I believe that we will continue to be meeting monthly, and that will be in a virtual format moving forward. I also have some funding through the grant that I coordinate that is going to help us to expand our reach to renters and bring more renters and property managers into our group so that they have a stronger voice in the decisions that we're making. But just know that I know that we've been on quite a pause given everything that's been happening with COVID, and for good reason, because I know we've all been thrown for a loop. But we are very committed to moving this work forward. There's a lot of interest within the city, and I'm very grateful to have all of you as partners in this work. Again, thank you to our panelists, Kelly, Eric, Pat, and Mike, for sharing their knowledge and perspective with us today. And thank you to all of you for spending time with us this morning to hear this information. And I hope that you go forth and use this information in your future planning and policy development. Thank you.
Thanks, Margaret.